Good morning. Again, today is Tuesday, January 6th, 2026. Present with us now is a health nurse supervisor, Pam Hanna. Pam, you want to tell us what's been going on in your department, please?
All right. Well, I usually start out with a little bit of communicable disease and what we've been doing with that. And this is kind of starting to be the peak of flu season. Usually in Montana, we see a peak in January or February. And we have seen a little peak already, so we're a little early on the curve. We currently have 21 cases of influenza. As of yesterday, I thought we had 11. 10 of them came in that were kind of late getting to us. I think holidays, things like that, they didn't get reported to us. So we do have 21 cases of influenza. They're all influenza A. 2 of those folks were hospitalized, and that was earlier in December. Our first case came in the end of November, and they've been all ages. They've been from all areas of the county, and most of those folks were unvaccinated. And I guess that's what I know about flu right now. We also have seen an uptick in COVID cases. As I've said in the past, those aren't all reported to us, but those that are tested in a medical facility are reported to us. So we have 8 active cases of COVID right now that have been reported. So we'll be doing an update on our December snapshot. We talked about getting all those numbers together at our staff meeting today. And so that should be coming out the next week or so. And those will have year-end totals on them for the whole year of 2025. So you'll see all the year-to-date ones will be our final counts for that year.
Can I ask you something? I mean, I know it's come up before, but how is it that they know it's COVID as opposed to flu because of the flu season? What is the actual
So
difference here?
there are different antigens that they test for when they test for COVID and flu. And so they can tell which illness it is by what antigen reacts. So that's how they test for the different things. There are similar symptoms.
Mhm.
And COVID symptoms seem to have changed through time. We're seeing headaches and body aches, and people are pretty sick with this strain of COVID that's going
I
around.
must have COVID all the time.
I know.
Fatigue, it's my
Body
ailment,
aches.
yeah. Yeah, we get out of bed and we ache, right? So, and with influenza, one of the symptoms that's really kind of hallmark with that is a higher fever. So it comes on fast and furious, and it kind of has that hallmark high fever. So those are kind of the things that we look for. So when they're testing, they're going to obviously test for what the symptoms seem to be. One thing that we did do, we received extra funding for our FEP, Public Health Emergency Preparedness Grant. And one of the things that was allowable for that was to get some COVID flu tests. So they now have an antigen test that tests for both COVID and flu at the same time, and it'll determine which one it is by which antigen shows up. If it's neither of those, it will say negative. If it's one or the other, it'll say positive for COVID or positive for flu, and it tells us whether it's A or B. So they're getting pretty smart. So we did order some of those. We're going to have them at our health department, mostly to be able to provide for county offices if we've got illness. So say we've got it in the clerk and recorder's office, we can provide test kits for that whole office so that people can make sure that they're well before they work. So did that answer your question? Yeah.
Yes, thank you.
Other things, we've had minimal other things, but we usually have some things. We've had some hepatitis C, which we had one long-term care facility where we get quite a few of those cases. And we had a salmonella last month. So just
'Tis the season.
Bad something they ate, yeah. Yeah, and I mean, 'tis the season for foodborne illness and for the respiratory stuff. People travel, people gather, people
Leave
eat
their food up way too
food.
long.
Yeah, that's been not cared for properly, and they become sick. It is, December was the end of a grant quarter, so we've got grant deliverables due either by the 15th of January or the 30th. FEP, they've extended our deliverables and for the month. They found that now this year, this grant year, we've been doing a quarterly budget report where we used to do an annual one. And with the budget reports, it takes us a little more time to get all that information sometimes, so they've extended us that period for 2 weeks so that we have time to get that budget stuff done. So all of our grants have some deliverables due by the 15th or the 30th. So we're working on those the next couple of weeks. With my Pathways grant, I am going to Shoto tomorrow and Thursday. Quarterly, we do an in-person meeting with the cohorts in that group to work on our project, to get our questions answered, to share. So Shoto's the place. I don't know why they picked Shoto in January, but we're hoping for good weather and above zero. So I will be gone for a couple days for that. And then we are meeting with HR and the insurance folks on, Jesse and I are on Thursday, because we had asked when we kind of did an after action from our health fair in August, that we start that planning process at the beginning of the year. So we're meeting with them on Thursday to start looking at what we're going to do for our wellness event in August this year. Some of the things that came out of that after action were that we wanted to possibly expand some services, be able to talk more about what preventative services we should be getting and what our insurance is offering, maybe bringing some of those preventative providers in, like maybe get a mammogram bus to come, some of the portable things, which is also a goal that we have in our community health improvement plan, is to do more mobile service in here to provide access to care. So we're going to talk with them on Thursday to kind of start that planning process so that we can kind of see how we expand what we do. We may need to have a different site location. We may have outgrown the volunteer hall if we're adding other.
Could you do it in the big barn, or is that?
It depends on what we put in there. One of the things that we had for feedback was that there needed to be more privacy for some of the things that we were doing. So that space we were in didn't allow for that. We're afraid that if we have it in multiple locations, that we'll lose people. They won't travel from one building to another. So one of the things that's been thrown out is to see if one of the schools would host us. We do have an MOU with the high school for events, and they were really gracious with us during COVID vaccination. We did some events in their gymnasium, and that seemed to work well. There's enough space that you can spread out and still have some privacy. So those are things we'll be talking about at that meeting on Thursday. We are also doing some wellness work within the health department itself. The School of Public Health in Missoula has some funding right now, and they're working with local county health departments to have wellness champions. So Aaron's ours, and we had a wellness event in November, and so we're trying to kind of do some more wellness mindful activities within our department to promote health and self-care for us. And then hopefully some of that we're doing might spread out into what we do for the whole county. One thing that we've thrown around is with building expansion is maybe to have a wellness room that's dedicated to have a space where people can retreat to on their breaks, and that maybe could be opened up to the whole county so other people could come and partake of whatever we've got in that space. So that's one of the ideas we've been throwing around. Let's see. We're working on that transition with environmental health still. Van Puckett the contractor did stop by after the commission meeting last week and talked with Molly, and she was I went back and said, these are the things that we discussed. This is what we'd like you to do. Please write down your questions for the contractor. So Van and Delilah did stop back and spent some time with Molly and kind of worked through some of her questions. So I think she's feeling a little more comfortable with some of that. In our staff meeting today, we talked about when Molly's gone, how do the rest of us respond? Because that needs to be shared information so that we can provide good service for our public. So we've kind of been working on that. A couple of things that have come up as we've had these discussions, I wanted to kind of make you guys aware of. And I've talked with Matt too. He said he didn't have time to come over today to just go ahead and throw them out. So Matt has 2 spaces he's working out of, the treasurer's basement, but there's still the workspace in the Paradise building that was a workroom there. So he's got stuff in both spaces. So I asked him what he still had that we needed access to. There is a big file cabinet in the treasurer's office that he says he's not in often, but that's not stuff that can be gotten rid of yet. I really don't have space in my office for another file cabinet. And then there's a few files that do need to come. So I had Molly clean out another drawer in our cabinet so we can put that. But there is that one, it looks like a big oak file cabinet down there that we can't just have disappear.
Right.
We have to, there's statutes of how long you have to keep stuff. So we need to be aware of that there's still some stuff in that room that needs to, we need to know where it is. And then I don't know what he's got in the workroom, but there's probably stuff there too that, when we get another sanitarian, we need to be able to have that stuff for them. So those 2 things, I don't know if you're gonna keep one of those offices dedicated for a sanitarian or.
No, for sure.
Yeah.
Yeah.
I think that would make sense.
To have all the stuff in until we
just
can
have
find
that room
something.
locked up or whatever, and we'd have a key to it, so if Molly does need to access stuff, but
Do contractors need access to any of that for any reason?
they
or is it
might,
just-
but generally they work through Molly to get to that. But I know Matt comes in and out of our office several times a week to get things, so I would expect that Van or Zach would, maybe need to stop in and get paperwork too. But what I'm hearing them say is that they're really wanting Molly handling the paperwork end of things. There's no reason to be paying them to come and handle paperwork.
Sure.
So that's what I'm hearing. And then it sounds like Shane set up an email so that there can be email communication and emails sent back and forth. And then my question, because I always wonder this, is what's going to happen with that budget? Are you guys handling that budget? Because I sure don't want to.
Yeah, we can handle it.
Because I don't know anything about it.
We'll probably handle it. We'll have to figure out
Yeah.
the expenses of the contractor, and Molly's really the only other thing there is.
So the way we set up Molly's time is that she's got a column on her timesheet that I approve for environmental health.
Okay.
So she documents her hours, and then the clerk and recorder's office takes
Mhm.
that out of the sanitarian budget on her end. So
Okay,
FYI,
that works good.
yeah,
We've got a couple employees that work 2 different jobs and have 2 different
yeah.
hours on their pay.
Jesse does too.
Okay. Appreciate you taking that on.
Well, really, my vision is that environmental health is part of what we do,
Yeah.
and we work together on a lot of things, foodborne illness, rabies and dog bites, those kind of things, we do work together, so it only makes sense. And in larger jurisdictions, they're all under one roof,
Mhm.
so I'd
Hopefully
still
we
like
will
us
be.
under one roof eventually,
Hopefully soon, yeah.
but, it's just been a little bit of trying to figure it out.
Right.
And I think once Molly is comfortable, it'll work out all right. She does have that learning curve and that comfort place where she has to get before
Right.
she is real comfortable with it.
Sure. Yeah, we'll do the best we can.
Okay.
I'm just glad we have.
I
a
just
van.
think good communication, I think we'll be fine. And, Van's got a lot of experience and he's very calm. I've watched him both professionally and personally. He's just very calm.
Mhm.
He's, very professional. I
Good.
think he'll be easy to work with.
Yeah.
And then that other contractor, he's okay too.
The one related to you?
Yeah. That
Yeah,
one.
they were at the meeting that day and I think they'll,
Yeah. No,
Do a
I
great
think
job.
they're gonna be good to work with.
We're fortunate we have that.
Yeah. So I guess that's what I have on my list. I don't know if I've forgotten anything, but that's what I have to report.
I don't have anything.
Okay.
You guys are busy. Do a good job.
We're always busy. It keeps us out of trouble sometimes, so. Oh, I think that one other thing that we did discuss in staff meeting today is, kind of follow up for the power outage event. I think people don't always realize that public health is involved in emergencies, but whenever there's people involved, we're people, And so, I think Jesse would kind of like, and I think he's been working with Doug to kind of do an after action on, that. Then we also talked about communication. I think because we've had this event, it's a great time to really push personal preparedness. So I think we're gonna be working on some of that too. And then on a state level, that rural health grant that the state applied for, Montana received the 4th highest funding for that. We don't know where it's going. On my end, because we don't have a rural hospital, I've been really pushing EMS, prevention, and behavioral health, because that's what I think we need.
Priorities, yeah.
And then, of course, access to insurance and funding is another thing I think everybody needs. So kind of listening, got my ear to the ground on that one too, trying to figure out where that's gonna go and if we're gonna have some benefit from that money, but it's quite a bit of money.
Good.
So that'll be good.
Be good.
Yeah.
How are your substations working out down Whitehall, Clancy and all?
They're good. We were a little worried with Mayor Mary leaving that we still have a welcome space, but we've been reassured that we're welcome there. And they were cute at Christmas. They put a tree up for us so we could have a Christmas tree in our space and they called us, said, if you want to bring some decorations, we put a tree up for you. So they've been very welcoming. The only struggle I've had in Whitehall is the Wi-Fi thing. And I talked with Shane about it again. We may end up having to do a hotspot to have us get in there. I told Shane, I really don't want to pay for a hotspot because I didn't budget for it. So he's gonna look at whether we can enable the hotspots on our phones, because each of us nurses has a cell phone.
Okay.
If we can enable our work hotspot, that's a no-brainer.
Gives you Wi-Fi right there.
Right, so, and it's just the nurses who are down there, so no matter which one of us is there, we could do that. So that I'll follow up with Shane on. The Clancy Clinic is good. I mean, we're there when the library and the museum are open, so there's quite a bit of foot traffic. We're kind of through that busy season down there because we get a lot of vaccinations from that north end. We didn't get as many until COVID, but now they know we're there and they like that we're close and they don't have to travel to get their vaccine. So we've got a following out there now. And that's my clinic where I get the most walk-ins. People will just, see my door and say, oh, I have a flu shot. And they'll stop in and get them. So I'm always carrying extra with me when I go there. But it's pleasant. It's nice. It's good to have access on all the ends of the county. So,
Good.
yeah, and we've got some good partnerships with the people we're working with too. So that makes it nice. So, hey, life is pretty good.
Great.
So have we heard any more on the title search on the building we're in here?
Yeah, the title search
Title's good.
came back clean, so.
So are we meeting again or are we? What are we-
I'm waiting for direction from Steve on what to do next. I think we'll probably do some kind of a buy sell and get it, set what we wanna do, what do we wanna pay for or whatever, and move forward that way, so. I'm just waiting for Steve mostly.
So lawyers next steps, and then after that, what would be a next step?
Probably what we need to do is talk to Leah at some point and figure out, that money. I mean, not that we wouldn't take the building if we didn't have the money, but talk to Leah and just tell her, that funding may or may not be available because her grant was supposed to be settled by May or something, wasn't it?
Yeah, I think so.
So, but if we get the grant, we'll have to figure out if we wanna keep going that direction or if we wanna divert that funding into this building or what we wanna do. So there'll be some decisions to be made. But I think that if we can get the building and maybe even start figuring out how we wanna set it up, we can get the old plans and you can write on it and we can get the
Right, kind of look at what we need.
yeah, get them to redraw it to what we want it and any other ideas out there. I really want to talk to Intermountain and say, okay, well, here's a chance to do something different with the building. If you guys, whatever the county can provide for your space too, is that anything?
Well,
they want,
yeah,
or-
if we have the whole building, there might be other things to look at, like that ambulance bay, their emergent, they use it for some things. But could that be the conference room, which would give us more room on our side for offices if we're bringing environmental health in?
Sure. So, yeah, so once we get a kind of a legal binding document that says, okay, the county is gonna do this, then we can start looking at redesign and all that. And I actually got a call from Stephen Walters, the dentist here in town, and he got all the equipment out of the dentist here by L&B Grocery out of that office, it's all good equipment. He said, why can't we put a room in this facility that you're gonna do and try to offer dental stuff too? So that was thrown at me just off the cuff too. So they're thinking about that. I said, well, we'll have to have somebody as a dentist. We can't just have dentist stuff there without dentists. He said, well, that's where the 3 dentists that live here in Boulder would have to step up and say, we can do 1 day a week for the people in Boulder, something, there's ideas like that floating around. So I think
Well, that's part of that whole integrated health, if we can get everything under one roof, then that
Yeah.
just makes a lot of sense.
So yes, so as soon as we get it legally bound to the county, then we can start looking at design and what we can do and how far out in the parking lot to expand that and what
Right.
Intermountain needs or wants. And, physical therapy's always been top of mind, and can we set aside something that's by itself that doesn't have an entry into anything else that can be physical therapy and maybe a dentist part of that? I don't know. So that's all ideas we'll
Yeah,
have to
they
work
could have
on.
a shared space or a shared reception or.
Something, yeah. So,
There's the 90,000 that's dedicated for the immunization room or the waiting room
okay,
that's in my coffer. And then I don't know, there was that 120 or 125 in ARPA money, and I don't know if that's available.
I think there might be some of it left. We had to spend that we have to spend it by the end of this year for sure. So I think we've been whittling away at that on different major projects, so.
Yeah.
But we still have the $900,000 with the
Yeah.
local assisted funding that
Yeah.
we need to spend, so. So that'll be the bulk of our money to do a remodel on this building, so. So I'm
Okay.
excited about it. I think it'll be a really good thing.
Yeah, I am too. not gonna work forever, so it'd be nice to,
We'll get it all set up before you retire,
yeah,
Pam. That'd be my goal.
yeah,
You'll be able to have your retirement party there.
there you go. I think it's good.
And after retirement, you'll have a place to go.
Yep. No, I don't know. I probably have 4 years left. We'll see. Maybe 2. We'll see. See how I hold
We'll
up.
see if I get reacted to, this
Yeah.
might be my last.
Yeah. If I hold up, if I keep walking and moving, maybe 4. If not, I have to come in a wheelchair and not coming.
Yeah, we'll have a wheelchair ramp, come on.
We do have.
Yeah,
to-
we'll build that.
Maybe.
We'll be adjourned.
All
Thanks,
right,
ma'am.
thank you.
Take care,
For the rest
Pam.
of your
Thank
day.
you.